Good afternoon, good evening, good morning for those of you who are in that part of the world where the sun is just rising up. It's my pleasure to welcome you all. For those who don't know me, I'm Jorge Diner, Director of Hadassah International, and it's my pleasure to welcome you to this extraordinary event, part of our Hadassah International Summer Summit Health Talks with Hadassah Experts and friends. Today we have a very interesting set of speakers and a very interesting topic, and actually the topic that we see in the event, the theme of the event, is the topic that we chose to advertise the event. But actually, besides talking about transplants in times of COVID, there is one main topic we are going to be speaking about today, and it's the topic of altruism. And that's so much about the period we went through. Altruism, it's all about dealing with a pandemic like COVID-19, when asymptomatic people need to take care not of themselves, especially young, but of others. And you have to make sure you protect yourself, not just to protect your own health, but to make sure that you're protecting the health of others. That's something that humanity will probably learn through this crisis, and we all hope about that. But these things are happening all the time, before, during, and after a pandemic like COVID-19. When it was a pandemic like COVID-19, we all become people who are part of the crisis. But people deal with situations like this all the time. And we have this wonderful panel today in which we will hear about what altruism is about when we speak about transplants. We have my dear friend, Dr. Abed Khalaileh, who is the director of the Kidney Transplant Service at the Department of General Surgery at Hadassah in Kerem. Abed, who is now sitting after hours of working at Hadassah, sitting at his home at the Beit Safafa neighborhood in Jerusalem. He was born in Jerusalem of Palestinian origin in a family of 7 brothers. His career, and I will make it short, his career brought him to study medicine and train himself in medicine and become a specialist in the field that brought him to the position where he is now at Hadassah. From France to Turkey, having studied his first studies in Russia. So he, besides he being an amazing medical professional, he's a polyglot himself, talks several languages, a communicator that is so critical in the work that he does when dealing with transplants means also to dealing between humans who have to connect for saving a life. We are going to have, in the second part of the event, we are going to have Mrs. Raquel Heba, who is now running an organization called Matnat Chaim. This is an Israeli nonprofit dedicated to encouraging healthy volunteers to donate kidneys to patients who require a transplant, donors who receive no monetary compensation for the donation, and altruistic donors who don't know who are the recipient is prior to the procedure. It's a not-for-profit organization, and the only motivation of the volunteers is their desire to help others and save lives. Rabbi Yeshayahu Heber, Zichrono Livracha, was the chairman and administrator of Matnat Chaim until he unfortunately passed away in April this year. And now Raquel, proudly for the world, is running his legacy and running the organization. We will start with Dr. Khalaileh, Abed, trying to understand how did you deal with this complicated challenge of transplants in the middle of a lockdown in Israel through this pandemic?
Good evening for everybody, and good morning. First of all, would like to thank Jorge and John for organizing this great talk and meeting, Summer Summit Hadassah International. As well, would like to thank Raquel Heba for the agreement to talk with us today. So let's start. Can I have my slides, Jan?
You need to share your screen the way you did. Yes.
You see?
Yes.
Okay. So I would like to talk about the challenge of transplants, as Jorge asked me to talk about during the COVID-19 era. So actually, we know that COVID-19 started 21 of February. The first case was discovered in Israel. And 11 of March, we had the social distancing. Following 1 week, we had the national state of emergency in the country. And unfortunately, 20 March, we have the first death in the country. So by 15th of March, the steering committee at the Ministry of Health started the deferral for non-urgent transplantation. So we stopped all of the living, let's say, donor kidney transplant in the country. And later on, I will tell you that like 2 months following that, we started again the program. And since that time, we had performed more than 44 live donor transplants. In general, when we look for the numbers in the country, you can, this is a heavy slide, but let's focus on it. So we can see that we have in the country more than 400. This is the number of the diseased in 2019 kidney transplant that had been performed. And this is the number of the living donors. So we had been done like 400 kidney 1 year ago. And for the liver, you can see we have 76 disease, and we have like more than 12. This is in the whole country. The main issue and the main problem when we talk about the transplantation in Israel, we have what we call the waiting list mortality. So actually we have more than 1,000 patients that they are waiting for the kidney transplantation, and more than 150 cases of liver that they are waiting every year. And if we divide those patients, the kidney and the liver, so let's talk about the liver issue, the mortality. It means that those patients that they will die waiting for the liver, it reaches about 20%. It means 1 out of 10, they will die from waiting for the liver transplantation. And the mortality rate for those they are waiting for kidney transplantation, it reaches like 5%. So what are the characteristics of transplant community in COVID-19 era? First of all, we know that those patients are heavily treated and they are immune suppressed patients. Second, they have frequent contact with the healthcare system. They have a lot of comorbidities, ischemic heart disease, hypertension, diabetes, peripheral vascular disease, and etc. Most of them elderly patients. Actually, we know that the solid organ transplant recipient may shed greater amount of virus from longer duration than otherwise healthy hosts. But no data until now that solid organ transplant recipients are at higher risk for acquiring COVID-19 infection than the general population. So how were the donation center affected by the COVID-19 situation? This was one of the questions of Jorge. So first of all, we want to stratify the patient according to the urgency. So we had what we call ESAS, the elective surgery acuity scale. So we have the low acuity, intermediate, high, which is we have in every one of them 1A, 1B. But most of our patients fell in the intermediate and high acuity, meaning those transplant recipients. we should have in our mind the hospital capacity, including the staff, operating room, and ICU beds. So when we were thinking to stop or to withhold all of the elective transplant, we took all of the things in consideration. We should think about separation of those patients. So we know that in Hadassah Hospital was one of the leaders in the country that they separate the COVID-19 patient in isolated building. Testing, we were one of the leaders in the country. We started to test the staff. And I will talk later about testing the patient for elective and urgent procedures. I will not talk about all of the drastic measures to control the outbreak, the hygiene, the PPE, and the social distancing. We know that well, but we had a lot of things in reorganizing inside the team, meaning the transplant team. The team player, we had what we call the capsule. So some of the team, they should work in some days. They don't they should not be in direct contact with the patient, all of the team, in order to preserve a team for the work. We were working with the telemedicine. We have the Zoom meeting, the hotline for the patient following the transplantation. And nevertheless, which is very important for the team, is to keep the high moral among the staff. When we talking about donation and donors, so we have the DBD, donation after brain death, DCD, donation after cardiac death, and we have the family, the living donation, family altruistic. Raquel will talk more in detail about the altruistic donation through Matnat Chaim. And we had the cross donation, the donor exchange program, which is some of go through the Ministry of Health and through Matnat Chaim. How can COVID-19 affect transplant surgeries? Actually, in order to ask this question, we should do risk stratification versus benefit. It means, is that procedure, it's urgent procedure? Like when we talk about liver transplantation, we should stratify those patients according to the MELD. The MELD is some kind of calculation that include in itself some numbers of creatinine, the kidney function, the liver function, bilirubin, and the INR, which is, the coagulation profile of those patients. And we come in this, we have number, and if the number is low, like 8, and it can reach 40, when it's very high, it means that the patient's survival is very low without the liver transplantation. For those patients, whether they are waiting kidney, we should take in mind the access failure for those patients. So we should stratify those patients according to the urgency. I will talk about the donor screening, which including the careful history, chest imaging, microbiology test. How it works, COVID-19 screening pathway before surgery. Let's have a patient that is waiting right now. We had tomorrow kidney transplant through Matnat Chaim actually. So this patient had been seen by us in the hospital like 2 weeks ago. We prepared everything. We had the history that there no fever, no contact, no respiratory symptoms. Day 14 until day 2. We have our I'm sorry. We in contact with those patients. So we just today we did chest X-ray for the patient. If we need, we will do CT scan. This is day 1, and today we took for him swab test, and it become negative. And the day 0 tomorrow it will be the surgery. So this is actually the screening pathway for those patients that they are for elective cases during the COVID-19 era. But for those patients that they are going for disease donation, meaning cadaveric, we will do ad hoc all of those questions, and we will do chest X-ray and CT scan for the whole body and the swab test. And if those tests are negative, then we will proceed with the cadaveric donation. What are the OR protocol? OR protocols, I'm meaning operative room protocols. They are general in everywhere. The anesthesia, wearing a 95 mask. Those, I will not say it working very strict in our hospital, but we are trying to stick to those protocols. So minimal staff scrub, to be far away during the intubation if the patient is, at high risk. What are the clinical features of COVID-19 among solid organ transplant recipients? Fever less common. Actually, I just published an article in Annals of Transplantation, and this was multi-center like meta-analysis, and we have seen that the fever, it was one of the most common symptoms actually. Possibly, the fever is a consequence of the effect of immunosuppressive therapy on the systemic inflammatory response. For that, this fever, but the data shows it's those patients that they have fever, profound lymphopenia, the lymphocytes very low, and it again the severity of the illness is based on the comorbidities of those patients. But we talk about the diabetes, ischemic heart disease, and etc. The effect of immune suppression, I will touch it a little bit in detail. The interplay between direct viral mediated injury and associated host response. We talk about direct or indirect, which cause lymphopenia. The management is similar to that for non-transplant recipient patients. All specific antiviral agents being used for the treatment COVID-19 are investigational. Use of this agents is generally limited to hospitalized patients, and we just adjustment the immune suppressive regime and it should be individualized. To answer for this question that submitted by Jorge, is there a risk for transmission of COVID-19 by transplantation of organs? Is theoretical, based on detection of viral RNA in organ that can be transplanted, and we need an additional studies to determine whether the COVID replication competent. And actually, no data in the literature about that in those organs. There were another question from Jorge. Jorge, are you with us?
Yes.
Yes. So you asked, are those who passed due to COVID-19 eligible organ donors? Actually, the optimal deferral period is not known, but we know from the AST Society, American Society of Transplantation, they suggest to wait like 28 days from the time of diagnosis and complete resolution of symptoms, if living donor, before organ donation. It will not work for those, unfortunately, that they are diseased, because we will not wait that time. This is a little bit, I will focus on what we had been done through during this period. So we see that starting March, even we had this pandemic, we had like 3 cases of cadaveric kidney, 2 living. April, we still had, April, we hold the program. So we had just cadaveric, 2, meaning deceased donor, and we had no cases of living. And starting May, we already did 3 cases. 2 of them, it was from Matnat Chaim, and June, we had 2 cases of disease and 4, and we had done like 29 cases until now. According to liver transplantation, we can see that in the whole country had been done since, January until now, 30 cases. We had like 11 of them. So we still, have the chance, even during the corona, through the pandemic in April, we had done 3 cases of liver, And if you remember, we had 2 cases. So actually at Hadassah, we worked hard, even at Corona, I can say. So what are the take-home messages? Actually, COVID-19 it poses a new challenge for individual solid organ transplant candidate and recipient. I would say that we should keep both infected and non-infected safe. And this was one of the strategy of Hadassah Hospital, leading by Professor Rothstein, to keep both the building isolated. I think what I talk about, the high MELD patient can rapidly progress for the, for the liver, and those with no access for the kidney, and more, it sounds that more lethal than the COVID-19 actually. Because the mortality rate for those patients, it could be more than even 30%, I guess, or even sometimes 50%. And when we talking about the COVID-19 for, let's say, for the kidney transplant patient, it could reach in the literature right now 18% by the article that I published and I mentioned before. So you can lose the opportunity. Surgery often is the best bang of the buck. 20 May, there were only up to 20 new cases per day throughout the entire country. 1 month, just 1 month later, we have around 500 cases per day. So we need, again, draconic measures. We should keep everything again. So we're in the hospital today, and it sounds, not good, but I hope that we can control this, again, pandemic, and we should talk, we should work together for that. And I think understanding the mechanism of the disease is the key for this process. So thank you very much, and I hope to hear from you for your questions.
Thank you, Abed. This is I think this is a very interesting topic. It deals with a very critical challenge that patients face when they are waiting for a transplant that can save their lives in times of uncertainty. And I was thinking, and that's a question I wanted to ask you. I was thinking about there is a regular anxiety for any donor recipient waiting to receive an organ through transplantation and transplant, and that kind of anxiety, I guess, is doubled by the fact that they don't know what's happening with elective, if the hospitals are closing their elective activity, if they become an urgent case and elective. How you have been dealing with this?
Thank you, Jorge. Actually, it was, as you told, it was, some kind of an anxiety for those families and for those patients. Some of these patients, they are really were suffering. If we are talking for, for the kidney waiting patients, they are suffering from dialysis. Some of them with, a lot of infections, and they are waiting, and it was some kind of, how to deal with those patients and to reassure them and to tell them that it will be soon open the program again. And for those liver patients, as I told and mentioned before, for those urgent cases, we should work and we should open and we should do the surgery. But for the elective cases, sometimes we should, wait, because we should stratify the risk and benefit from the surgery. But in general, in Hadassah, actually, this was one of the hospitals in the country that we didn't close and close the program. We were doing, a lot of even elective cases, some kind, This is something which I think it's unique for Hadassah because the isolation. We had like 2 hospitals inside the hospital.
Yes. Now, building also on the patient experience here. What happens and how do you deal with patients who actually receive an organ? They are recipients already, and because of all the things that come after doing this, and immunosuppression in order to move through this process in a period when there is a risk for COVID-19. How do you manage that, and what are there any additional risks? That is a question that's been posted on the chat already. Are there any additional risks and things that have to be taken care compared to regular times, when in any case they have to take care of what happens right after transplant?
We were following the transplantation, the patients should come to the outpatient clinic, but during that area, and still even for today's, we start the telemedicine, so we kept in direct contact with those patients following the transplantation by the phone, and tried to keep them away from the hospital sometimes, and even to help them and to ask them to send the blood test. And there were a lot of work, let's say hotline for those patients. We had a hotline, so they were able to call, and there were med personnel that they can answer them directly and help them what to do in order not to get to the emergency room.
And what about donor organs? How do you monitor? I think you mentioned that, but I think in more like simpler language for all of us who are not medical professionals. What about organs that come from donors? What kind of screening you do to make sure that that is healthy organ in what concerns here COVID?
If we are talking about living, so again, history, then physical exam, then chest X-ray, then swab test for RT-PCR. We don't use blood test for antibodies. For those deceased donor, meaning the DBD and the DCD, the donation after cardiac death, again, we do whole total body CT scan, and we have a swab test before accepting any donor, and for both the recipient and the donor. And if it's negative, if they don't have contact, again, there is a lot of issues about the contact with the family, and there is nobody sick, and during the last 14 days, he had no contact with somebody that came from out the country, and he by himself, he was just, there is a lot of issues about the isolation. But in general, we don't accept if everything should be, fixed before that.
So still, as usual, you are very forward-oriented and optimistic, and looking at this, I've known you through the years, somebody who always believe, and I know in transplant, I think it's something you really need to have, because you depend on so many variables to get organs that can not just heal your patient but save the lives of your patients, and it's a very, very challenging, not only professionally but emotionally, I guess, for doctors and professionals who deal with this situation and with patients. I think it would be interesting now to hear Raquel, and we will leave time for questions back to Abed in a few minutes after Raquel speaks. But I think you are on the other side, on the side of working with those who will be willing or are willing to give their organs to donate, and I think what were the challenges, or what are the challenges in a period like this when people are more afraid of what's happening with their lives. They are more concerned about their health. They are more concerned about the health of their families, and the eventuality that they will need to help them more, because we live in a period of uncertainty. How do you find this period different than before in terms of the work that you do to encourage people to do altruistic giving of organ giving donation?
Should I talk it to me?
Yes.
So first, should I speak a little bit about Matnat Chaim in general?
Yes. Yes.
Okay. So my name is Raquel Heba. I'm the wife of Rabbi Yeshayahu Heber that passed away 9 weeks ago from COVID-19. He was 55 years old, and people told me he didn't die fast. He didn't die early. He just lived very fast. So I'll tell you how everything started. My husband was working very, very hard in 2 jobs. He was also running a school of 1,200 children in our neighborhood, and he was also teaching in the afternoon and at night. And he thought today he was very weak, and we thought it's because he's working too hard, but we finally realized that we went to the hospital because he wasn't feeling well, and we saw that his kidneys failed, and he's very, very ill, and his kidneys actually stopped working. Very suddenly, we found ourselves in dialysis. I say we because when he was there, I was there too. There at the dialysis clinic, he was sitting couch next to a couch near a boy named Pinchas. Pinchas was 19 years old. My husband was 42. But since Pinchas was a boy sitting at dialysis without teachers, and my husband was a teacher without students, so they made a little school in dialysis, 1 student, 1 teacher. Became very close to each other, and when my husband, after close to a year, he went out from the dialysis to life because he got a kidney donation from a good friend. Pinchas begged him and said, Rabbi Heber, please don't forget me, don't leave me behind, please find me a donor too. So the first thing my husband did after he started to recover, like 6 weeks after his surgery, after his transplant, he started to search for a donor, for Pinchas, and we found someone, and that's a very sad story. Pinchas was, actually, I didn't tell you at the beginning, Pinchas lost his only brother that was killed by a terrorist, and while he was sitting, sitting Shiva, and his brother, who was very confused, very, very upset and very sad, he did not take the medication that every recipient has to take, and he lost his kidneys. That's where my husband found him. So Pinchas needed another transplant. And when my husband found him someone, but 2 weeks before the date of the surgery, Pinchas got a heart attack or something. His heart failed and he died on the way to dialysis. 2 brothers, 2 only sons. And my husband was very, very upset. He lost his close friend from dialysis, and he said, no more people should die in dialysis. He always used to say that the day Pinchas died, that's the day Matnat Chaim was born. That's the day my husband said, I'm going to leave my jobs, 2 jobs, and I'm going to take all the people here in Israel out of dialysis. Actually, people thought he's crazy. People thought he's out of his mind. What do you mean taking people out of dialysis? How could you do it? People told him you're dreaming. And he answered them, maybe I'm dreaming, but I'm not sleeping. And he wasn't sleeping. He was all the time working and working and working and thinking how to create such a thing. So he really sat with doctors, with nephrologists, with surgeons. He sat down with religious leaders, with ethics, with people that had to do with ethics and others. And he learned the topic, he searched things, and he gave materials to people. And he just told everyone about it, about the option to give a kidney, to donate a kidney and to save life. Whoever wanted to hear, just heard every day from him, and every, a few times a day, how much it could be simple. Although he always told people, I'm not convincing you. We never ever convince people to donate a kidney, because that's not like donating $100 or even a donation of blood or whatever. It's actually going into the surgery room and giving and saying goodbye to an organ, saying goodbye to one of your kidneys, and to people that you don't know. And it's not, and every surgery could be dangerous. He told people everything. He gave them all the information, but he never convinced. And the first year was 2008. We had 4 kidney transplants here in Israel through Matnat Chaim. By the way, the name Matnat Chaim in Hebrew has a double meaning. It's a gift of life, because actually you're giving life by saving them and giving a kidney, and from living donors. Matnat Chaim, the first year was, we had 4 kidney donations, and we thought that we captured the Everest. The second year, 11. At 2019, we had 136 kidney transplants. And at 2020, since January this year, we had already close to 70. Wow. This week only, in 5 days, between Sunday and Thursday, we're going to have 8 kidney transplants here in Israel in all the transplant centers, which is something I don't think there's something like that in the world. So we also did transplants out of Israel, a little bit in England, at the Royal Free Hospital, in Brussels, in Germany. But we got to the stage that, thank God, here in Israel, our tiny state of Israel, we have today, I think today is one of the world leader in altruistic kidney donations. Our donors, I always say that they're angels. I mean, they just come and just want to give life. They just want to do good. They refuse to get flowers from the recipients, chocolate, I mean, nothing. They just go into the surgery room, saying goodbye to the kidney and saying goodbye to the patient, to the recipients, and they tell them, please don't even tell us thank you. We have to tell you thank you, that you gave us the chance to give life. So how did we do it? How do we do it until now? Now, unfortunately, I'm now the chairman of Matnat Chaim. I was always there with him, on the side of him. So now I'm here in the front. But I guess all those years that we were together, and we started in our small home, in my kitchen, with one old computer and 2 cell phones, just to raise the awareness here, I mean, in Israel. So I was always learning from him how to do it. So he was actually training me through the years without even knowing that he's going to leave me so fast. But so now we're just continuing his ways. And how do we do it? We publish stories of donors, kidney donors and recipients. We put them all over in magazines a few times a year, in the television, at the radio, wherever, in the neighborhoods, we hang signs. We just, wherever we could just famous it, we just famous the idea and just giving the information, how you could do it. We have the back of the hospitals. Dr. Abed Khalaileh is one of the family here, because it's a family. Matnat Chaim is one big family. Besides being a very, very talented and special doctor and surgeon, he's a special human being and sensitive. And that's what makes him one of the best doctors here. And we are very proud to share with Hadassah the transplants. And we do many transplants in Hadassah. We have 5 main centers here in Israel. Up to now, I think up to today, we have 800. We already done 833 transplants. Again, we famous, I mean, we publish the stories, and a friend brings a friend, and mothers and sons, and fathers and daughters, and we have siblings, and we have one family that's 3 daughters, 3 sisters, and 1 brother-in-law from one family donated kidneys. We have, it's a joke, but it's true. The people are, you know, they make support meetings to themselves, whoever has 2 kidneys, whoever still stays with 2 kidneys, because people sometimes are embarrassed to go outside of their neighborhood because they still have 2 kidneys and not 1. People are, even now we try to help people with antibodies, and we're trying to help people just to go back to life, which is a lot. Go back to life, and to be, you know, well fathers and mothers, and to try to go back to work, and to start living. People tell us, our donors always tell us that they're only sorry that they don't have, very upset that they don't have 1 more kidney to give another one. So us in Matnat Chaim, we bring the awareness, we support them, we mentor them, we have the connection between and after and before, and we actually are one big family. Since we saved the country, by the way, we saved the country's millions and millions of dollars, because taking over 800 people out of dialysis is a big save for the country, and we're happy to do it. And everyone that just goes out of surgery room happy, with a smile and healthy, this is life for us too. So we're going to try to do the best to finish the list here in Israel. There shouldn't be more a waiting list for people that are waiting for a transplant. Just the list should be only from donors they want to give.
Thank you, Raquel. I think, you know, we admire, I think I communicate the feeling of the audience, at least my own feeling. And, you know, we admire your strength. We admire the work you do, the living message that you transmit in periods like this. I mean, in any period is very powerful. In periods like this, what the world is going on now, what you've been going through, I think it's one of the most compassionate and inspirational messages we have got in dozens of webinars we have been doing in the last several months. And I think that we will make sure this voice is heard. And I think you mentioned one thing, and say we're one family. And when I hear you talking, and I know you worked together for many years with Abed, with Dr. Khalaileh, and, you know, and we are one family, coming from different backgrounds, you know, regardless of any geographical, political, whatever differences that might be on other things. You know, we are one family when it comes to saving lives. You know, I was thinking, and I want to bring back also Abed to this part of the conversation. I was thinking that if there is one historical figure that I think talks to me right now, is thinking about Maimonides, Rabbi, you know, Maimonides, who was one of the greatest philosophers for civilization, not just for Jews, and also a physician himself. He was a philosopher and a physician, and he lived in that period of Sepharad when Jews and Arabs, you know, were creating philosophy and art and culture together in what was Sepharad at the time, and he wrote then one of the things that speak about the levels of tzedakah. You know, the 8 levels of tzedakah that I know many here know, and you know, I think that if he would live now, he would invent the 9th level of tzedakah, because there is a level of tzedakah that is give part of your life so somebody else can live.
Right.
And you invented that level of tzedakah. That is, it's just you know, we can give away, and sometimes, you know, it's hard for people to give away things they have. It's hard for people, but, you know, when they want to do something, they make a difference. And as you say, giving a donation and giving your time, you know, it's amazing. That's what everybody, I think, and most of the people who are in this webinar today are involved one way or another in giving their time as volunteers or giving donations. giving an organ so somebody else can live, and it's really something that we should command. I want both of you to relate to that experience of working together, and from both sides. Abed, I know that that you've been working with donors, and this has been also an experience that goes beyond, I think, the medical side of that. And if there is anything you want to share about that, I just want to make sure you have a chance to share.
You know, first of all, God bless Rav Heber. He actually just, you know, maybe say, I can say like a couple of months ago, we met home at Sukkot, my wife and Raquel and Rav Heber, and it was a wonderful meeting, really. And I learned a lot of from him. And he was not just one that we worked together. He was one of the best good friends, really. So we were talking like every day, every other day we were talking. If I need something, I can ask him, and he also as well. So I can't even express my feeling right now. But you know, I believe that it's like a tree. You know, I can't go to the surgery room right now without the feeling that Rav Heber with us, really. And with every case of living donor, I you know, like imagine and see him in front of my eyes. And this is one of the wonderful things. And I believe that a lot of surgeons like me, they do the same. And you know, even the donors, they feel the same. So even they come through Matnat Chaim, but they still have the feeling that the Rav Heber is around us. So I think that he's still with us, and I believe in that. So Raquel is doing a great job. All of the family around in the Matnat Chaim, they are a wonderful people, and they're doing that. And I hope that we will push together, and we will keep together working, because it's, as mentioned, Raquel, this is, you know, one of the most important things that, you know, you can do surgery for money, and you can gain money doing plastic surgeries. But when you do surgery like transplantation, it's like, you know, like a pregnant woman that gives birth. It's like that. This is a new organ, and this is a new life with the kidney, with the liver. So, and hope that we will continue doing the same.
Yeah. And I'm also saying that we work with Hadassah and with Dr. Khalaileh and all the staff there. And when my husband passed away, I said, I know that I'm not alone. And we could, as my husband, he could have called Dr. Khalaileh even in the middle of the night, asking questions about his donors or his recipients. And he always, every minute, he answered him wherever he was. And it was, you know, it's very sad to say, but my husband didn't die at home. He passed away in Hadassah Hospital. He was there for 10 days. I had no connection with him because he was unconscious. We didn't even say goodbye to him. We were with the Covid-19, the whole family. He was there, but actually he did die at home, because Hadassah was a kind of a home for us. We used to come there a few times a week to visit our donors and our recipients. And I was calm. I knew he was in good hands, and there in Hadassah, which is a little bit of a home for us. And we continue to come home and to be there. As Dr. Khalaileh said, my husband is with us. And we hope that nobody will need us anymore. Everyone will be well. But if they need us, so we're here and they're here. And everyone should feel good always.
Thank you, Raquel.
Thank you.
Thank you. Thank you to both of you. I think we'll make sure that the recording of this event will be seen by many more people. there are many of us here who are part of the Hadassah family that we feel also that Hadassah is our home. And for all of us listening to you, it's kind of like a very strong reminder of why in the first place we became part of this family called Hadassah, of that, you know, this is a microcosmos of what Hadassah is all about. And at the end, it's a bridge for love. It's not even a bridge for peace or a bridge to, it's a bridge of love. And I started, you know, I opened this session talking about altruism, and I think I want to close talking about empathy. It's all about understanding the needs of the others. I've been ready to go the extra mile. This is a year where all of us have to go an extra mile. Giving an organ to save a life is going the extra million miles. And we admire people doing that. And we admire you, Abed, Dr. Khalaileh, for making sure that those people get the best transplant they can, that you research all the time to make sure you could do more and better, and not just you, but your colleagues all over the world. That's what Hadassah is about. And we want to thank you for taking this time to be with us and leaving that inspiration that I think will be with us for a long time. Thank you everybody for being on this meeting. And we wait to see you in our next events during the summer summit. We will be sending more information for the next events. Thank you for being with us. Have a great afternoon, great day, or a great evening. Thank you.